Good morning. Hopefully everybody can hear me. Today we are joined by Lisa from OhioHealthy. Just some housekeeping. If you have a question, please type it in the question box. We will answer questions at the end of the presentation. I'm Becky Kinnaman, a broker advisor in the Columbus office. That's my contact information. And I'm going to hand it over to Lisa.
All right, thanks, Becky. Okay, so OhioHealthy is owned by OhioHealth. It's a provider-owned health plan. And one of the reasons, and if you want to go to the next slide, one of the reasons that we are huge in Central Ohio, pretty much 50 to 54% of all claims run through OhioHealth. Not sure if everyone's aware of that or not. But so we're really big in the community, and our previous president or CEO, David Blum, really wanted to get out there and provide, better health care to everyone. And by doing that, he wanted to lower the cost of health care by starting an insurance company. So we're really widely known. We were actually mentioned as the 7th most trusted brand in America. And we're like the #1 most trusted brand here in Central Ohio. And we insure, right now, we insure about 49,000 members in the Central Ohio community. And it's been a slow start, I'll admit that. We started out as a joint venture with Centera because OhioHealth had never been in the insurance business. We wanted somebody that mirrored what we're doing, and they have a provider-owned health plan in Virginia that does very, very well. So once we started in this joint venture, they had a different direction they wanted to follow. They wanted to start out in the Medicare area and individual area, and we did not. We wanted to be in the group area. So OhioHealth decided, okay, let's start over. Let's own OhioHealthy. And they became a part of the whole process. And so we have the backing of a $7 billion company. So we're here to stay. We're not going anywhere. But we've run into a lot of trials and tribulations just getting started. We thought we had the best discounts out there for our own plan. Actually, we found out we did not. So we went in and did a lot of work. So we're just actually getting really started again. And I know some of the brokers saw our frustration in the previous years, and now we think we're getting it right. I really feel we're getting it right. I've been involved in all the meetings of getting new products launched. We're not launching them yet, but I've been in the whole process of building, and when we launch products, we'll let you know. So currently, if you want to go to the next slide, just again, OhioHealthy. So we're integrated. It's a little bit different than your regular insurance companies. Your regular insurance companies get you on the plan and hope for the best. You're going to go to any one of the hospitals, but they're not involved in your claims like we are. So the true integration is that doctors, I work next to doctors every day. I work next to our care management team. Just you name it, we work next to everyone. And they get very involved in everyone's care. So if you want to move on to the next slide. So just to give you an idea of where our service area is. Now, one of them we have to take out, which is Muskingum and Guernsey. We have discounts in those hospitals. We actually own SEO RMC, which is in Guernsey. But we filed, and then there was something different with the filing, and so we have to start all over again. So we're hopeful by next year we can actually take businesses that are located in Guernsey and Muskingum and sell in those areas, but right now we cannot. And the map changed, and for level funded, when our level funded product comes out, we will be selling in Ashland, but for ACA, we won't be selling in Ashland. So the rest of the areas is everywhere we can write business for small group. Anything in the blue dots is an OhioHealth facility. Anything that's in the orange dots are hospitals and centers that we have really good discounts with, one of them being the Cleveland Clinic. So this shows you our whole network. So COPC is in. We have the huge CIN network, which is about 4,700 members in that with specialists and doctors and things like that. Nationwide Children's is in our network. And you're going to notice that Ohio State and Mount Carmel are not in our network. And, you know, again, we're a provider-owned network, so we're not going to, it's like if you went to work for Nike, you're not going to wear Adidas shoes into work. So if you look at this, if you're working in OhioHealth and have an OhioHealthy plan, you're not going to have Ohio State and Mount Carmel in our network. Like I said, we cover more than 50% of the claims that are coming in through the Central Ohio area. We don't advertise a lot. You'll see that. We have not done that, but we actually cover more cancer care than Ohio State. A lot of people aren't aware of that, just by volume. So we pretty much take everything and we can cover it, so that's not a problem. But I did want to mention, there was one other thing on here. I can't see the screen very well because it's so tiny. So for anything outside of the green areas, our RAP network is PHCS. And so if somebody has a student in college, or if somebody is, you know, traveling or whatever, or living on the cusp and going into another county right here in Ohio, they're going to have coverage through our PHCS network, and they have the widest range of doctors and facilities, more than any other RAP network out there. So I'm not sure if anyone's aware of that, but that's pretty much how that works. So if you want to move to the next slide. Again, this is a list of some of the hospitals that are covered in our network. And we're actually adding to that list. We're going to be announcing some more building that we're doing in some other outlying areas of Central Ohio where we're building more hospitals. We bought quite a bit of land, and you're going to see more hospitals coming into the OhioHealth network. We're also looking at buying some other hospitals as well. So just a heads up on that for what's coming in the future. And then if you go to the next slide, again, this is to show you, this is where Central Ohio is in the Ohio map. Anything in the blue is where PHCS is, and so that's where you're going to see. Now, the Aetna RAP network is for our large group plans. So anyone that's in a group over 100, they will have the Aetna RAP network option, and it's the signature RAP network. Now, I'm going to tell you, in the small group area, I work the 2 to 99 market. My cohort in crime, I call him David Dajitsky, works large group from 100 on up. So right now, the only plans we currently have for me to sell is our group ACA plans, and they run about 20% lower than any of our competitors. And we're working on getting a new level funded plan out. We did previously have a level funded plan through Trustmark. We thought they were going to be a good partner. We are in growth mode. They actually are not in growth mode, so it wasn't a really good fit for us. The two didn't align, and in the beginning, they thought they were in growth mode as well, but it just did not work out, so we pulled that product. We actually are partnering with a new company, Amwins, who owns stop loss company, and they're going to be helping us build the product for the level funded market. And for our large group fully insured, which is 51 on up, we're going to be partnering with Havarti. So just to give you a heads up on what's coming, but most of those products won't be available up until for a 1/1 effective date. So we'd probably begin quoting around 9/1. So just to give you a heads up on that. But right now, the only product that I would have for the small group brokers is the group ACA plans. And Dave Dajitsky is selling the ASO plans right now in the large group space. And our premiums on those, what they're running into as far as cost, is about 27% below pretty much every other company out there. The other thing that I want to hit on for you is that, and I'm going to make the math easy. So I'm going to give you an example. If you're on the OhioHealthy plan and you are using an OhioHealth facility, let's say you had $1,000 MRI charge with OhioHealth, but let's say you're on an Anthem plan. So you're going to get that rate discounted to about $500. If you're on the OhioHealthy plan, that rate would be discounted to $275. So that just shows you how low our discounts are in our own network with the OhioHealthy plan. So not only are you saving on premium, but you're also saving when you're using our facilities. So that's just something I wanted to touch on there. If you want to move to the next slide. So we do have digital tools. I won't touch on this too long. Just you can go to OhioHealthyPlans.com and look at our materials. And we also have, when a member comes onto our plans, we have a digital tool where they can have it at their fingertips. The nice thing I like about this plan is you can look up your providers, you can look up claims, you can look up everything that you need to know, transparency tools in our portal, so everyone will have access to know what charges are where. And coming down in the roadmap for us is we're going to actually specialize in pointing out where, for instance, if you need a knee replacement, maybe that's going to be at Devlin Methodist Hospital that does the best job and is the lowest price. So people are going to be able to go in and get that detailed on what service they're having done and see where they want to have that service completed. So you move to the next slide. So in previous years, we had partnered with ESI Express Scripts as our PBM, and we changed this year. And the reason we did that is we have probably 38,000 members of the OhioHealth plan because we're a big company. And believe me, if something goes wrong, we hear about it. And one of the problems that we had with ESI is that Kroger was no longer in network, which was a real problem for a lot of our members. They do their grocery shopping there and they want to get their prescriptions filled there. So we partnered with Navitus, who's really big. A lot of people haven't really heard of them as much in our area, probably because they mostly work with provider-owned health plans. And I haven't found a pharmacy they don't cover. They cover the mom and pops, everyone. So everyone's pretty much in. That is not a problem. So, and we've had really good success with them. There's a lot of different formularies that we can use in large group. We've pretty much determined what the formularies are going to be for small group. And believe me, we cover more than most other companies cover in the drug space, with the exception of Ozempic and things like that. So a lot of the small groups don't want to take on that burden right now because the cost is so high on those drugs. Your Good RX coupons, you don't have to take into the pharmacy any longer when you're on Navitus. And the reason for that is that they will look up in the system and see which price is better. Is it better with Good RX or without? And they'll go ahead and apply it. And probably what a lot of you are not aware of is that if you do use a Good RX coupon when you go in to your pharmacy, that will not apply to your coinsurance. So a lot of people aren't aware of that, but with this being embedded into the program, it actually does apply. So you're not getting that penalty with Navitus like you do with other companies. And if you want to move to the next slide. Oh, I thought I put the tool. They actually have a tool. It might have gotten mixed up in the slides that I sent. But they have a tool as well, and I love the tool. I actually use it a lot. I have a lot of prescriptions I have to get. I go on there and you can type in the drug and see which pharmacy what the cost is at every pharmacy, see which one is the least cost, and you can get your prescription filled there. So we have two specialty pharmacies, one being Riverside Methodist. And what's nice about that is a lot of specialty pharmacies, you have to have those sent to you. And with Riverside, you have the option, especially living in Central Ohio or any other area of Ohio, but you can drive over there and pick up that script. The other one is through Lumicera, and that's Navitus Specialty Pharmacy. And your mail order drugs are going to go through Costco because Costco partly owns Navitus, just so you're aware of that. So But again, there's no places, I have not seen a place where you cannot get your prescription filled. And prescription spend for all companies is on the rise, and it's pretty much getting to be about 30% of the healthcare spend. So one of the things we like to talk about is our member experience. So this is very unique, and I was actually surprised when I started with Ohio. I actually started with OhioHealth doing recruiting. I had taken a break from insurance. I've been in the insurance market for over 30 years, but I took a job as a recruiter. And after I started, I got a call from OhioHealth, and I said, well, why are they calling me? Maybe I did something wrong on my application. I don't know what it was, but they called me just to see how I was doing, asked if I had any health problems or health concerns that I need addressed, and if I needed to help finding a doctor or what they could help me with, which I thought it was awesome. The following week after I started my job, I actually have really bad asthma. I had a really bad asthma attack, was in the ER. They discharged me. I came home. The following day, I received a call from OhioHealth saying, hey, we noticed you were in the ER. Is there any concerns you have? Do you need to get an appointment with a specialist? We'll help you get to that specialist. Hey, we have an asthma program. And if you follow the asthma protocols that they have in their program, you can get reduced cost on your asthma medication. So I've been in that program since I started with OhioHealth, which has been 5 years, and have not been in the emergency room again. So we're very dedicated, and this is where the integration happens. We're very dedicated to getting in there and helping you manage your care and keeping you from being in the hospital, that type of thing. Again, anyone discharged from the hospital after an inpatient stay, they call you to see if you need an appointment scheduled, if you understand your follow-up care and what needs to happen, and they're very good at getting you all the help you need. If they know that you're going to have a transplant, that type of thing, they get you with a care coordinator that helps with all those things. And everyone that we get a lot of feedback from members that's telling us that that's been one of the most important things to them, is that we have been there and helping them actively care for their health needs. So it's extremely important, and we offer all kinds of programs to help you manage your care. You want to go to the next slide. And so again, this is just, so one of the things that we do too as well is a lot of people call when they have a claim problem and they get a customer service person that answers the phone. We actually are not we don't have customer service people. We have what's called an advocate. And those advocates, again, they're different too as well. It's not a big claim or something like that, but you're having problems. They'll even call the doctors and check in on that claim for you. So they're there to advocate for you. They also, people call and say, I can't find anyone in my area that I can get into a new primary care doctor with. Can you help me? And they will do that. And they will actually keep you on the phone and set up an appointment for you if you'd like to do that. So there's a lot of things that we do on the back end that a lot of people don't see. Okay, if you want to go to the next slide. And so that's pretty much what we have to offer now. Again, people might say, well, why care is getting so expensive? Medical costs are rising and rising and rising. Because we manage the care so well, and this is true of most, if you've heard of UPMC in Pittsburgh and some of the other places, they manage the care so well because we're integrated. We work together. I can pick up the phone and call a doctor for you if I needed to. We're able to keep our renewal costs low. So there's a big difference there than actively working with another insurance company. And they're finding too that, I don't know if anyone knows this, but Ohio is one of the most expensive places for insurance, for medical insurance. And that's because we have this big health system here in Central Ohio. We have Mount Carmel, we have OSU, and we have OhioHealth. And that gets expensive. It gets expensive for everyone because it dwindles down. You don't know exactly which hospital you may go to. It dwindles down your unit cost for each of the hospitals because they can't get as good of if you're driving care into one area, you're going to get a better price on unit cost of any service that you have. And if you don't know where these people are going, the discounts are not there. They're not as deep as what you could get with a provider-owned health plan. So is there any questions out there for anyone that I can answer?
It doesn't look like we have any questions just yet. Becky, do you have any questions for Lisa?
I don't. But thanks, Lisa. That was some good information. We look forward to seeing that level funded product coming out.
Yep, and we'll have a fully insured product as well, too. So that's going to be exciting. And I will keep you in the loop and let you know what's happening.
I appreciate that.
All right.
Still not seeing any questions.
If you have any, just email me or call me. I don't know if I need to put my phone number out here for anyone, or if you want to provide that. Okay, great. Yeah. All right. Well, just let me know. And it was nice chatting with everyone. And hopefully next time it goes a little smoother on getting on camera and getting the audio to work. So.
No problem.
All right.
Thank you so much for joining us today.
All right. Thank you so much. Okay. Bye.
Bye-bye.
Bye.